Hi, I'm Dr. Dan Sindelar, and people always ask, how do you get sleep incorporated into your practice? Well, let me tell you what we did and what our experience was. First, I would take your team to one of the weekend seminars and get them up to speed, and yourself, just on the subject of sleep. And at those, they offer usually overnight sleep studies, the home sleep study systems, for you to try out yourself. Your team can too. I strongly suggest that. It's a great way for you to get comfortable with it and understand how simple that is. Once you get that back to them, they'll give you a report the next day and you can see how that all works. So it also gives you a chance to try out some of the different systems. There's a number of them that I like, particularly WatchPat, Watermark, CleveMed are some of the ones I really like. So then once you do that, make your decision, purchase a home sleep study system. They're small, they're easy to incorporate into your practice. Typically the costs are anywhere from about, I believe, $2,000 to, I guess, up to about $5,000. And minimal investment, you'll find that you can pay for that within the first month you have it. Then bring that back. There's webinars, there's different ways to educate your team. Once you have that in your practice, then you can go ahead and start right away and become part of incorporating what I call it your own sleep center. It's not that you're having a separate part of your office, but it is like you're putting a sleep center in your own practice. And the home sleep study is the first step, and that's a great way to get started. To incorporate sleep into your practice, it's as simple as taking your team to one of the resources with education. Go ahead and purchase the equipment, and then bring it back and start using it. It's that simple, and you are on your way to incorporating sleep into your practice. Now, each particular system has a different way to charge out for your sleep reports. The one I use, and most of them are this way, where you purchase some disposables for each individual patient to use, and the purchase of the disposables, whether it's the finger pad, whether it's the cannula, whatever it is that attaches to the sleep equipment, part of the cost of that goes towards your paying for your sleep studies. So the sleep studies are basically free. You purchase the disposables, and that's how you pay for that. The minimal, I can't remember exactly, but it varies. So look into the different types. Some are as little as $10 per patient. A couple of them are a little more expensive, but they're a little more elaborate with what they can read. So once the patient brings the equipment back, you have a pre-assigned ID number and information on the portal is what they call it, but it's basically a website. Your team will go ahead and attach that to the web and download the information, and everything then is handled from that point on by the company that you bought your equipment from. The other thing I tell patients is hold on to your disposables. I have them keep them, and what we do then later is, after an oral appliance is placed, we go ahead and we have an additional study just to titrate the appliance and also verify how effective their treatment is. So once you've got all this, you've got the equipment and you've got everything in place, just start screening. Start asking questions. You'll be amazed. Everybody, and this is a great source of referral for you. You'll find that somebody's got an uncle or an aunt or a spouse that doesn't come to you, that it really is involved with sleep apnea and needs some help. A lot of times you find out the first thing they say is, oh, so-and-so hates their CPAP. When appropriate, oral appliances are a great alternative. So the typical home sleep study can turn into an oral appliance treatment for sleep in your practice that can return about $2,000 to $3,000 to the practice, and that's a great way to expand your revenues. On top of that, just think, if you do the numbers, if you did one a week, 3 times 4, that's $12,000 a month. If you did one a day, you're probably working 16, so 3 times 16, $48,000 a month. That's a pretty big increase in your revenues. And there's days where we're actually doing 2 appliances a day. So it can really rapidly increase your revenue in your practice. And then the benefit too is how many referrals you get because of just doing sleep, and patients that will come to you. I even have patients that will come to me for a sleep appliance and a home sleep study that aren't even patients of mine. Their dentist does not do it, and they'll come just for this and then return.